Hi viewers, welcome to Your Media Square. Today we are having a special guest, Dr. Meghna Verma, and she did her medicine MD from Mumbai, MD ophthalmology, and she did her executive MBA program from ISB, and then recently she did a postgrad diploma program in psychiatry from CMC Vellore, and she has loads of experience of 14 years in ophthalmology and medicine in various hospitals in Hyderabad like LV Prasad, PACE Hospitals, Refractive. She's one of the directors in the PACE Hospitals. Welcoming Dr. Meghna. Hi Meghna.
Thank you. Thanks for inviting me here, Surendra. And I would love to share my experience as a doctor and as administrator of hospitals with you. I'm also an NABH assessor and would like to share the best practices of healthcare management with all of you. So thank you for having me here.
Can you say something about healthcare management, how the young doctors has to learn this program, or while setting the hospital, what are the things they have to follow?
Yeah, so unfortunately during our MBBS we are only taught the science and we are not taught the management part of it. But once we become a doctor, management is definitely a part of your daily routine. Even if you are in a service, you are reporting to somebody or you are part of the management system of the hospital. If you set up your own practice, then there are a lot of people who are reporting into you and you have to take care of different facets of a hospital. And hopefully very soon healthcare management would become a part of our MBBS curriculum so that the young doctors know about how to set up a practice or how to be a part of a larger practice in a much more effective way. But certain tips that I would want to give is while you are setting up a practice, there are certain aspects. One would be infrastructure. So when you are setting up your infrastructure or you are part of another infrastructure, there are certain things which are non-negotiable, like the legal issues. So always make sure that your certificates are in place. The legal issues need not be only regarding your hospital setup, they could be regarding like pollution control board certification, or it could be regarding fire NOC and things like that. So all those things need to be looked into before you set up your practice or you are working for somebody else. You should be aware of the legal issues involved in a medical practice or the medical legal aspects of a practice. So that is these are the two important things, the infrastructure and the medical legal aspect. The third aspect, which is very important and we often forget, is the HR. Like, we don't work as doctors, we don't work in silos. We have assistants, we have nurses, we have technicians, we have biomedical people, we have so many housekeeping, receptionists, everybody, right? So a very important part of hospital management is human resource management, and this is some aspect that we are not taught during our MBBS, but yes, this is something that we should be more aware about and probably read up more about how to manage a good practice. The fourth thing that I would say, which is very important in the current world, is IT. So whichever setup, a small setup or a big setup you are a part of, you would definitely have a hospital management system, you would have an EMR, you would have digital marketing, social media presence, and things like that. So I think the fourth important part that is very important in your practice and you should know how to manage is the technology, the IT part. So very briefly, these are the four aspects that I would ask all the young doctors to update themselves on while they are learning their science.
Do you suggest any executive programs or short-term certificate course for this healthcare management?
There are a lot of courses. I mean, the MBA program, the one-year MBA program I did from ISB was in general MBA. But there are a lot of healthcare MBA programs which help you. and hopefully, as I said, it should be made a part of the curriculum of the MBBS curriculum, because it is not separate from what a doctor is expected to perform in his actual practice life.
So, as Meghna suggested, in healthcare management, there are a lot of disciplines, short-term programs and executive programs at all the top institutes. You can try in any for the further questions, you can write down in the comment section. And as I said, she works in Pace Hospitals in Refractor. You can consult her. You can post your questions in the comments. Yeah. Thanks for watching us, and we'll get back with you with few more videos.
Thank you for having me here. So thank you. And for any more questions, I would be really happy to answer them if you can put them in the comment section. Thank you.